To understand what a hiatal hernia is, most people need to understand a little bit of anatomy. The diaphragm, which is your breathing muscle, is really a dome-shaped muscle that separates your chest cavity from your abdominal cavity. There is an opening in the middle of the diaphragm called the hiatus. The esophagus resides mostly in the chest, and the lower esophageal sphincter at the very bottom of the esophagus is supposed to sit below the diaphragm in the abdomen, as is all of your stomach, which is below that lower esophageal sphincter. When the stomach slips up through the hiatus and into the chest space, that's what's called a hiatal hernia. Hiatal hernias can be very small, and often patients have very small hernias. Most patients don't have symptoms from very small hernias. Symptoms tend to occur from hiatal hernias when they are very large. Hiatal hernias are usually seen on imaging or endoscopy. Barium swallows, upper GIs are very helpful to identify hiatal hernias. EGDs or endoscopy can identify hiatal hernias, and sometimes very large hernias can be seen just on plain chest x-rays. Patients can have reflux without having a hiatal hernia, and patients can have a hiatal hernia without having reflux. But having a hiatal hernia, having that change in anatomy, really does make it easier to reflux, so they're commonly seen together. Very small hiatal hernias don't necessarily need to be treated surgically in and of themselves. There's no other treatment to fix a hiatal hernia. There's no pill, no exercise that one can do to correct a hiatal hernia. It's a problem with anatomy, but very small hernias don't need to be fixed surgically unless the patient has other more troublesome symptoms like uncontrolled reflux. Larger hernias, however, may need to be fixed really regardless of symptoms and regardless of whether the patient has reflux, because there can be a dangerous twisting of the stomach that can be risky. We don't always know why hiatal hernias occur in certain patients, but we do know that they're more common with increasing age and increasing weight.